Hey guys, welcome back to Medical Coding with Blue. Okay, today's episode is real talk about remote medical coding. I have been getting so many emails from new people who want to become medical coders primarily so that they can become remote medical coders. And what is it all about? And what are my chances? And those kinds of things. Okay, so I am going to preface this whole video with this phrase first. I am very direct. I am very honest, and I have been told that I am very blunt when it comes to my answers about this subject. The reason that I am so blunt is because I want people to know that I am being honest, and I have never, ever tried to discourage anybody from anything that they do. I believe that if you want to do something, do it, because the only person stopping you is you, okay? Now, if you get into those things where you start to snowball and start to self-doubt, I am going to do a separate video on that. I was actually going to do that video today, but this question keeps coming up, so I said, let me address this head on. When you want to become a medical coder and you want to do it because you want to do remote medical coding, I am going to tell you this right now. It's not going to happen for your first job. I am just being honest. In my entire career as a medical coder, I have never ever seen companies that will hire somebody with no experience to do remote medical coding. That's number one. Number two, you have to have a very secure area in your home. If you do get experience and you end up getting a job at home, you have to have a secure area at home, okay? You cannot be in the living room with everybody coming in willy-nilly looking at your screen. These things are private. This information is private. HIPAA does not mean that it's discounted just because you're not in a hospital or in a doctor's office. It is everywhere you go. You cannot discuss patients. You cannot show your family members records. You cannot do any of those things. You have to be in a secure area. You have to be hooked up directly to a line from the wall to your computer. You cannot use Wi-Fi a lot of times. I have never seen a company allow their coders to use Wi-Fi to connect to their website or whatever, because it's just the danger of information getting loose, okay? So there's a lot of things to consider with that. The other thing is, if you are trying to work at home, you think it's going to be so easy. Well, oh yes, maybe I'll go do a load of laundry and then I'll just start working, and then maybe I'll make a little breakfast and, do a little laundry, or maybe I'll go take care of the kids and come right back. The thing is, a lot of times when you are working remotely, your standard for production is going to be a lot higher than you would if you were actually in a hospital or a facility or a doctor's office. Only because they're going to expect you, number one, to already know what you're doing. Number two, you are not going to have any distractions. If you're at home, you're not going to have any distractions. So you should be able to reach a lot higher on your productivity because no distractions. So if you have little ones at home, and the reason that you want to get into medical coding is because you have little ones and you want to be there with them, keep in mind that once you start working, you really do need to concentrate on what you're doing. Now, you may think, oh, it's just reading and then selecting. No. You have to concentrate. Now, I've had many instances where I am even in my own office and I'll have to close the door because I need to be able to concentrate. I can't answer the phone, like my office phone. I cannot answer the door. I have to concentrate because of the simple fact that when you are doing this, you have to pay attention to what's going on in this record. There is a lot of things that go on. There's a lot of nuances and things like that. You have to work very closely with your providers to make sure that they are getting full credit for everything that they're doing. If you don't know what you're doing, they're not going to know if they're getting credit for everything. Okay, so this is why it's very important that if you want to become a medical coder and you want to start out at a place where you can go physically, so that way you can learn what you need to learn before you get turned loose on remote medical coding. The other thing is, you won't have somebody there to ask questions. When you first start out, you will have lots of questions. Even if you are very confident, oh, I'll be able to get it. It's no big deal. Trust me. I am a reader. I like to read. I like to read. I like to write. I like to do all those things. Before I wanted to get into, I didn't even know what medical coding was, okay? But before I got into this field, I wanted to be a lawyer. So I had already trained myself to read a lot and do a lot of papers and write and things like that. So that was already my foundation. I already had that. I had no medical background, so I did learn a lot. But when you are trying to learn and this is your first job, you want to have veteran medical coders around you so that you can ask questions. Now, some people don't like to ask questions, and if you're one of those people that doesn't like to ask questions, you're in the wrong, because you have to ask questions. That's the only way you're going to be able to learn. If you don't feel comfortable asking the people that you work with, come here, ask the questions here. I am offering this to you, to everybody. Everybody, I'm telling you now, if you have a question, it's a medical coding question, you cannot ask it at work, fine, just come here and ask the question. Don't flounder on your own if you're needing help. If you've done all of your research and something does not make sense, please feel free to come here and ask the question, because I don't mind answering questions. Now, I may not work in that particular clinic, but I can certainly try to help you find the answer, okay? So that is my promise to all of you, the viewers, okay? Now, another thing I want to bring up when you are remote medical coding, and I've gotten this complaint several times, there were quite a few viewers in the beginning when I first started really filming. Last spring, I really started getting into filming more frequently. And I had gotten a lot of emails from viewers saying that they had gotten into medical coding because they wanted to be remote medical coders. And then when they became a remote coder, after they had gotten experience, they hated it. They hated it because they were lonely. And it's hard to always be at home by yourself, you know, working and trying to do this, and you don't have your coworkers. Now, trust me, I know that there are times when you don't want to see your coworkers. And there are times when they work your last nerve, and that is the human nature about it. But to isolate yourself is very difficult. And some people are loners, and that's okay with them, and that's their shtick, and they're fine with it. But not everybody can always work very well in solitude. Some people need to have that interaction with other people. And I've been accused before of using work as a social playground. Whatever. I do not use work as a social playground. I like to communicate with my providers, because making sure that they're getting credit for everything is very, very important to me. I did have a situation, what was it? Thursday or Friday, one of the two. And I was going back and forth with one of my providers. And I'm just now getting into working with him, because he did fight me before, and he's still continuing to fight me, but it's okay. I'm working with him. I am totally working with him. But he said, well, I don't care if I don't get credit then, because he was missing a couple of pieces of information that were crucial to his documentation. He said, I don't care if I don't get credit, because missing those two pieces of information made the record uncodable as far as like diagnosis wise. I'm like, come on, I need this, you know. And he said, well, I don't care if I don't get credit. And I told him, yes, I understand that, but I do care. I do care. And I need you to give me this information, which it was very simple information that I needed. And so then he wrote back and he said, okay. But I develop these relationships with my providers because they have to be able to tell me what's going on. When providers start to lose credit and start to miss credit, it is really on the medical coder to make sure that everything is there like it should be. And that's very hard to do if you are a remote medical coder, because a lot of times, like these doctors, they get flooded in their inbox with just endless amounts of email. So not that remote coding is a bad thing, but it does take away from that human element of being able to connect with these providers and being able to get all the information that you need in order to code correctly. So that was my thing about that. But another thing to bring up, if you're wanting to get into medical coding in general just because of the money, and that maybe somebody's telling you that it's an easy field to get into and that it's very easy to pick up, to that I would say that whoever's telling you that is wrong. There is a lot to medical coding. It is a huge responsibility, and even bigger than some people let on, okay? Particularly if they are trying to be recruiters. And now recruiters have a very important job too. They have to get people, and they have to get a certain amount of people to get involved in this field. And I get it, that you're just doing your job. But at the same time too, if you haven't done your research and you're just, getting taken in because, oh, there's a lot of money and you can do all of these things. Well, yes, there is a lot of money, but we have to work for that money. And there's a responsibility with it, because whatever we select, whatever diagnosis codes we select, whatever procedure codes we select, whatever E&M level we select, any of those things directly affects the provider. It directly affects the patient. Now, the patient on the money side, okay, they have to pay out. If you are selecting the wrong procedure code, that poor patient has to pay because you selected the wrong procedure code. This is why knowing and learning things and being hands-on with being in a facility or being around other peers is so important, because this way you can make sure, and especially in the beginning, that you do this, because it is all a part of the learning process. And yes, you will learn things on the job. Yes, they will train you in some things, but they are going to expect you to know how to medical code when you walk in the door for that interview. And if you don't know, and if this is your first job, they're going to look at you like, well, I don't know. So that's why I say working at home is a privilege, and it's really for those who have been in the field already and have that experience already and know what they're doing. Okay, that is the hugest part of it. So please reconsider if that is what you want to do. Another thing that has been brought up a lot is people want to do this part-time. Can they do this part-time? I don't know all the places that are hiring folks, so you know what I mean. I do know that there are PRN positions or as needed positions, and those are just basically whatever the contract or whatever hours they're having you work, or whatever the case may be. This is why I tell you guys, ask lots and lots of questions, because you can ask me. I can tell you what I know, which I don't know every employer in the US. So you're just going to have to ask them, okay, if that is what you want to do. I always encourage everybody to just do whatever it is that you want to do. Believe in yourself. That is a huge thing. And you don't have to believe me. And I'm not trying to sell medical coding to anyone. I just want you guys to know what you're getting into before you invest time, money, and energy into getting into it. Okay, so ultimately the decision is yours. I just want you guys to know that this is what you're going to be up against. That don't try to go in it thinking that you're going to be able to start remote coding right away as soon as you get your credential. That is an unrealistic goal. So, I mean, I'm just saying, okay? So consider making sure that you work someplace, and then you can transition to working at home. Okay, that is something that you can shoot for. That is more of a reality that can happen, okay, if you do that. So I hope that this has helped in some way. Like I said, I don't want to discourage anybody, but, and you don't have to take my word for it. You don't have to if you don't want to, but I have been in the field long enough to know, and I am pretty well straightforward, because I would never want anybody to go into something not knowing all the details. And that's another thing that people tell me about too. Well, you're so detailed. That's you. But if I don't say all of these detail things, then maybe you never heard about these other things that go along with this. That's why I always bring everything out. Okay, I just put it all out on the table, and I told you guys that I'm going to be very straightforward and put all the cards on the table. These are the cards. These are what they say. So everybody's experience is different, but I hope that you all know that when I'm telling you guys things, I'm speaking from experience. I'm speaking because this is what I know. This is what I've been through. This is what I've experienced. So I'm going to go ahead and wrap this one up. So I will be doing my next video about techniques and strategies for dealing with self-doubt when you are a medical coder. I have been getting a lot of those emails, the what if emails, and I think it's time that I address that as well. So I'm going to go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye.